Hi there, I'm Bree Wright. I'm a registered nurse and certified foot care nurse and nursing instructor. I've been practicing for over 20 years and I'm here today to talk to you about the Onyfix nail correction system. This is a brand new revolutionary nail correction system. It is not a brace, there's no torque involved. It is an absolutely pain-free, non-surgical, non-invasive, evidence-based medical device that is suitable for even your most high-risk candidates. It is a Class 1 medical device, which means it has been verified by Health Canada as a procedure that can be used to prevent or treat a condition in a medical setting. Now, Onyfix has many purposes and uses. It can be used to treat ingrown nails, involuted nails, pincer nails, onycholytic or detached nails, those split nails, even fingernails, pedaloid nails. It is excellent for both acute and chronic pain relief from ingrown toenails, is fantastic for nail restoration of those unhealthy nails. It can be used for nail reconstruction and can also be used as an adjunct to surgery, such as your PNAs and TNAs. So we all know that involuted nails cause pain, inflammation, and eventually infection. How does Onyfix actually work? I was so surprised when I did go to Germany and met with the Neuberg representatives there to learn what makes Onyfix different. And honestly, the theory behind it is so simple. I don't know how we haven't come up with it sooner. Basically, most nails grow straight at the matrix, but end up curling in the nail bed because sometimes the nail is just too wide for the nail bed. So to compensate for the lack of space, the nail ends up curling, following the path of least resistance along the nail bed. The Onyfix, when polymerized or hardened, provides the support that the nail needs to keep that straight shape right from the matrix as it continues to grow. So with the support of the Onyfix band, the path of least resistance is no longer to curl, but actually to maintain that straight shape. And this is why we place the Onyfix as proximally as possible without touching the skin. It's important to remember that the skin has oils that can cause the bond to break. We want the resin to be as close to the matrix as possible to encourage straight growth. It then stays on for the entire length of the nail as it grows out. And I have that depicted here in my next slide. You can see here how the Onyfix fixes the nail shape from the proximal end and returns it to the proper form through its own natural growth. And that is something that we don't see. There are no braces or hooks or torque or anything that's going to put those high-risk patients or patients who are high risk can't use those type of systems. When you get your starter kit, you're going to get 2 boxes. You're going to get your blue product box and your white Onyfix toolkit. Now, in your white Onyfix toolkit, you're going to get your LED blue light, your cannulas, your spatula, and some cotton tip applicators. This is everything that you need to actually do the application of the Onyfix strip. We do get a lot of questions about the Onyfix light. The light is an LED light that focuses on the near infrared rays that are healthy and do not stimulate carcinogens. It filters out the harmful UV rays and does not concentrate them enough to cause eye damage, so neither you nor your patient will have to wear glasses. I know that many of us have lights in our practices that we're already using, but it really is important to use this light. The polymerization or the hardening of the Onyfix compound requires a very specific power and wavelength that this light meets perfectly. So it really is best to use that. So the blue box that you get with your starter kit is the product box. And it's really important to note that Neuberg has been exceptionally generous, and they've actually given you enough product to do 70 to 80 treatments, recognizing, of course, that this is a very tactile sort of service that you're providing, and so extra product is provided so that you can practice before you implement it with your patients. So that's really nice. Now, the products in the product box, you've got your Onyfix primer. And the primer is used to prepare the nail and increases the bond of the composites on the nail by more than 50% by dehydrating the nail. Now, when you come to the Onyfix soft and hard products, it is interesting to note that both products are exactly the same. Onyfix is Onyfix, but Neuberg provides them in different consistencies for ease of use and different applications. So the Onyfix hard is a denser compound, and we typically tend to use that on big nails, thick nails, and stronger deformations, whereas the Onyfix Soft has a more glue-like runny consistency, which works really well. It's much more suited for small nails, thin nails, nails that just have more movement. The Onyfix Soft seems to work better. In addition to that, you can also use the Onyfix Soft on split nails. So we'll get a little bit more into the different uses right here. So in picture number 1 here, you're going to see that's a hard Onyfix full strip. So you notice we place it as proximally as possible. All of your strips should always be 2 inches wide by 2 inches high. And this is really the strip that you're probably going to use the most for those involuted large toenails. The Onyfix hard can be used as well for ingrown, involuted, onycholytic, split nails, the restoration of unhealthy nails, as well as PNAs. Now, when we come to your distal half strip using the hard in picture number 2, when it gets to the distal portion of the nail has more lift, there's more movement, and that's typically where your hard full strip is going to fall off. It takes probably anywhere from 3 to 5 months, depending on how quickly your patient's nail grows. But the movement there causes the Onyfix hard to dislodge, and that movement is actually quite beneficial when you're thinking of applying a half strip. The half strip is applied for acute pain relief from an ingrown toenail. So if you take a look here, if you picture my patient came in with an ingrown toenail and I had to remove a spicule distally here, that tissue underneath is quite inflamed and sore. And so by applying this distal half strip, because there's more movement there, it actually provides the littlest bit of lift, providing immediate relief to those inflamed tissues underneath. Now, because it is kind of in that danger zone of where there's a lot of movement, that half strip likely isn't going to stay on for very long, but you only need it for days or even a week to let that tissue underneath settle. So I make sure I let my patients know I typically put on a hard strip, proximally a full strip, to correct the long-term involution. But if they have had an ingrown toenail, I will put a secondary half strip, and I let them know that will probably fall off shortly, but it will provide them immediate pain relief. So that's really important to know. And two, just another little tip or trick, if your patient has very, very severe pincer nails, a little trick is you can actually put 2 full strips right across, and that will help relieve the pressure distally. It's just important that you let your patient know those distal strips will likely not stay on for very long because of the movement in the area. Now, if we're talking about the soft Onyfix and its uses, I've got 3 pictures for you here. The first is a full strip with a single layer proximally. So we typically use that on the smaller nails. There's not enough room on the small nails to work that hard resin in without touching the skin. So the glue-like consistency of the soft product, it comes in very handy here. So we do, again, same use as we can use it for ingrown nails, involuted nails, onycholytic nails, split nails. This you can also use for a TNA as well as your PNA, which we'll discuss, and the restoration of unhealthy nails. If you have a nail, say a large nail that you put the Onyfix hard on, but it's say thin, and the Onyfix hard strip keeps popping off, what you want to try to do is use a double layer, as you see in picture 4, a double layer full strip of the soft. So I mentioned earlier that the Onyfix soft tends to bond better to those loose nails, whether it's a small nail or a large nail. And when you put a double strip on, it actually has the same strength and density as one application of the hard. So that's a neat tip or trick that you're going to see in the video coming up. That works really well. And then number 5, the picture there, that is when you're dealing with onycholytic or split nails or nail reconstruction. The Onyfix can actually be put over the whole length of the nail, and it actually will keep that nail from splitting as it goes. We all have those patients who have nails that continue to split as soon as it, breaks free from under the cuticle. And so this will actually help with that. And I've got some pictures to show. One thing I do want to go back on is this distal half strip. You'll see in our clinical video, our instructor was one of the very first to go to Germany, and so he's getting quite fancy and advanced with his technique. So you'll see he actually, with his half strip, makes it almost a T. And so what he's finding with his distal half strip is if you put an additional vertical strip there along where you've just removed that spicule, it actually provides a little more lift and a little more support. So if you're concerned about that nail being very flimsy and you still want to get that distal half strip on for acute pain relief, we do show that in the video for you to do as well. But whether you're doing just a straight horizontal strip or you're doing, like I like to call it, the TOM method, the T method, either or will give that patient acute relief. So here are some pictures of the different indications for use. So when you've got your onycholysis for your detached nails, it is for the active treatment and prevention of detached nails. You want to trim your nail back up to the point of attachment of the nail. So you want to trim that nail as far as possible so there's no free nail hanging, and then apply the soft Onyfix onto the remaining nail. The soft Onyfix is best. The Onyfix then allows the nail to grow in properly, fused with the nail bed. It just provides that support that it ends up reattaching in many cases. And this is how we use it for split nails. So for vertical splits, you want to apply a proximal horizontal strip. You can use the soft or hard. Again, just remember, if that nail is very loose or flexible, you probably want to gear more towards the soft. You can also put a whole nail application. Definitely want to use the soft for that. It is best to not do a vertical strip. Many people are tempted to do a vertical strip straight down along, but it doesn't immobilize the nail properly enough to prevent the split from happening. So you definitely want to go with either a horizontal strip or you want to cover the nail completely with your Onyfix soft. These are those very frustrating pedaloid nails typically found on the fifth toe. And so you simply want to cover, almost as if you were treating a split nail, cover the entire nail, including the crack, and look at the results that you're getting afterwards. This is used in adjunct with your PNAs and your TNAs. So there is a misconception sometimes that Onyfix is meant to replace surgery, and that's not the case at all. Onyfix is meant to be an adjunct to an alternative that you can offer in your practice. So there are some people who just refuse to have the surgery, or some people, they're very high risk and cannot have a matrixectomy. You've also got children or special needs patients that surgery they're not good candidates. So you can try the Onyfix to correct the involuted nails and their issues with ingrown nails with the Onyfix. But in addition to that, we are now finding that post PNA and TNA, the Onyfix is actually correcting the regrowth of the new nail. So that's quite fantastic. It's important to note, so when you're doing a PNA, you can put the Onyfix strips on right away, right after the surgery. Have your patient come back after probably 2 months, and you'll want to do so that you have a double layer. A double layer as the nail grows always is best. And so reassess. Most patients need about 2 applications of a double layer for the correct regrowth of that nail. Now, when you're doing the total nail avulsion, obviously you can't put any Onyfix on the nail right away. There's no nail there. So have your patients come back 2 to 3 months. Once you've got a little bit of the nub of nail, it's important you use the soft Onyfix because it just adheres better. That new nub of nail is so fresh and so delicate that the soft is what you're going to need to adhere. So apply a very nice layer across, and then have your patient come back about every 4 months, and you may want to reapply another strip. So this is for restoration, just for healthier nails and improvement of the surrounding nail tissue or nail bed. It can help prevent further complications such as ingrown toenails, involuted nails. Something that's really interesting to note is that after using the Onyfix, a lot of patients will say, okay, my problem is corrected. Am I going to always have to use Onyfix, or is the problem going to reoccur if I stop? And what we're finding after about 4 years of studies is that the nails are not re-involuting once the Onyfix has done its job, unless there's a major biomechanical issue or your patients are wearing completely inappropriate footwear that encourage reinvolution, the Onyfix has actually corrected the problem. So that's very encouraging for you to tell your patients. When it comes to nail reconstruction, you need a minimum of 15 to 20% of the nail plate. You need that much as a base to stabilize the Onyfix on. And you're going to apply the Onyfix, the soft Onyfix, to the whole nail bed in a double layer. Now, the one thing to note about this is you don't want to apply the primer to the skin portion. It won't bond as well, and it's not healthy for the skin. Nail polish or art can be applied immediately after, and they can last for 4 to 12 weeks, depending on your patient. So the Onyfix, the steps are very, very easy, and I'm going to show a clinical video right away that goes through it, but just very briefly to tell you, first thing you want to do is roughen the nail. You want to use a diamond burr to roughen the nail. It'll just provide a little bit of grit. It's not a really harsh burr. It'll provide a little bit of grit that lets the Onyfix strip bond better. You then want to degrease the nail with rubbing alcohol. Then you want to apply the primer. So just a thin layer, you just put 1 drop in the cap, apply a thin layer of primer, and then you want to cure the primer. Now, this is a step that so many people tend to miss. You want to make sure you take your LED light and cure that primer for at least 45 seconds. Once you've done that, wipe off the residue with alcohol, and then you're going to apply, be it your soft or hard Onyfix, apply your composite. You want to cure or dry your composite, make sure it's 2 inches wide, or sorry, 2 millimeters wide by 2 millimeters high, and you can work with it as long as you need to. As long as you don't touch the skin. However, once you harden it, it's on. So you want to then cure the composite with your LED light for a minimum of 60 seconds. When you're done, you simply wipe it off with the rubbing alcohol. You then want to make sure that you're leaving a nice, smooth, professional finish. And I recommend using a ceramic burr for that. You do not want to use a diamond burr on the Onyfix for the same reason that you don't use a diamond burr on, say, gel or shellac polish. The composite it's an infection control issue because the composite has a consistency that will actually get into the pores of the diamond burrs, and you won't be able to sterilize the burr after properly. So a ceramic burr works wonderfully. That's what I recommend. So I'm going to just take a couple of minutes here to show you this quick clinical video where we're going to go through some of the things that I just discussed. And this will be provided for you separately as well, just for quick reference, but I think it helps things come together after we've just talked about it to view the video.
Please watch as we model the 6 easy steps of the Onyfix application. Step 1, nail preparation. Lightly roughen the surface of the nail with a diamond burr. Step 2, use rubbing alcohol to wipe away the dust and debris for a clean working surface. Step 3, take your primer and put 1 drop in the lid to prepare the nail. It does this by dehydrating the nail, allowing the Onyfix resin to bond more securely. Use a clean cotton swab to gather the primer from the lid, and apply the primer over the entire nail and nail bed, making sure to include the sulci and the grooves. Remember, you only need 1 drop. Too much primer can leave the nail moist and be detrimental to the bonding process. Step 4, cure the primer with your Onyfix light for 30 seconds. Don't touch the nail with the light, but get as close as you can. Remember, this light is not harmful, so neither you nor your patient needs to wear glasses. Step 5, the composite application. Here's an example of a hard Onyfix application following your nail preparation steps. The Onyfix Hard comes in a twist tube. Each turn of the cap is 1 millimeter of product and approximately enough for 1 Onyfix strip. If the nail is large, you can do a turn and a half to make sure you have enough product and just discard any extra product should you have any. You will notice the consistency of the Onyfix Hard is comparable to that of a putty. As it should be stored in a cool place, you need to work with it a little on the toenail to warm it up before you form it into a strip. After getting the desired amount out of the tube, use your Onyfix spatula to place the product on the nail. It's very important to remember to not touch the skin during this stage, as the oils in the skin can disrupt the bonding process. Allow the Onyfix to warm by gently folding it back and forth until it feels pliable enough to easily form a strip. Slowly start to place your strip as proximally or as close to the matrix as possible, running as far medially and laterally as you can without touching the skin. You can taper the sides slightly to help it conform better. As you can see, the application is quite easy once you get a feel for it. And in fact, the studies show most practitioners can effectively do a proper application in under 6 minutes. This is very convenient as it makes it such an easy addition to an already existing appointment. Remember, the finished Onyfix strip should be 2 millimeters high by 2 millimeters wide. Use the body of your Q-tip for reference before you harden. Step 6. Cure the Onyfix resin for 60 seconds with your Onyfix light. Use your ceramic burr to smooth the hardened Onyfix strip for a smooth and professional finish that won't catch. You cannot use a diamond burr, as the Onyfix compound will clog the pores and the burr will not be able to be sterilized properly. We will now demonstrate the application of the soft Onyfix strip. You can do this following the nail preparation steps already discussed. Your Onyfix kit comes with single-use cannulas to use with the soft Onyfix product. As you can see, it has a push tube style syringe applicator as opposed to the twist tube style of the hard Onyfix applicator. This is because the soft product has a runnier, more glue-like consistency. Start by priming the cannula until the product is at the surface of the cannula. It is important for you to remember to pull back on the syringe following the procedure and before you discard the cannula to not waste the product that was primed. Apply the product to the nail in a smooth strip. Remember to not touch the skin in any way. You can then use your spatula to shape and place the product in your proximal 2 millimeter by 2 millimeter strip. It generally requires less shaping with the soft product than the hard because of the lighter consistency. It is important to note that although the consistencies of the Onyfix soft and hard resins are different, it is the same product. Neuberg has supplied different textures as a courtesy for the practitioners for easier application to the different issues. For example, the hard Onyfix is typically used on the hallux or strong deformations, while the application of the soft is much easier for smaller, thin, brittle, and chipped nails. When necessary, and we will demonstrate, 2 layers of the soft composite is equivalent strength-wise to one of the hard. You can now cure your Onyfix application with your Onyfix Light for 60 seconds. Here we are demonstrating the application of a second layer of soft Onyfix. You apply the second layer immediately after curing the first with your light. This would be done to strengthen the soft Onyfix on a strong deformation. Use your Onyfix light to cure the soft compound for another 60 seconds. This is an example of how to apply the distal half strip for those acute patients after following the proper nail preparation steps previously discussed. After removing an ingrown nail or spicule, cleanse the area properly. Place a moist, sterile 2x2 under the affected distal corner. Remember, if body fluids or oils from the skin come in contact during the application process, it is unlikely the Onyfix will adhere properly. If there is an active infection, it would probably be best to have your patient return for the treatment after a few days of antibiotic therapy. If this is not an issue, this technique will cause a slight lift to the affected area, giving your patients immediate pain relief as the pressure is reduced from the swollen tissues under the nail. Keep in mind, this distal application will only stay in place for a few days as the distal part of the nail is more unstable, But even that short period of time will relieve the acute pain of the moment, while the proximal strip you will also place will begin to slowly correct the long-term involution, likely the cause of the problem. Cure the Onyfix resin for 60 seconds with your Onylux light. The Onyfix removal. Should you decide to remove the Onyfix before it naturally falls off, simply take a set of splitters and gently snip at the edge of the strip. It comes off very easily. Use your ceramic burr to smooth any remaining product. As you can see, it is a very simple and, again, pain-free procedure.
Well, hopefully that was clear as mud for you all. I want to get into some advanced technique guidance. We get a lot of questions. Nobody's nails are the same. You're going to come across many different things. So let's take a look at just some suggestions. The first we've already talked about. You want to make sure for the most effective relief, you want to make sure that the overall size of your Onyfix strip, whether it's hard or soft, is 2 millimeters wide by 2 millimeters high. You want to make sure it's nice and uniform. You don't want it to be bumpy or lumpy. The strip should always be applied in a straight line. Now, people get really, especially with pincer nails, people tend to want to apply it in a curved fashion. They want to end up putting it in a U shape or a C shape because they think they should follow the line of the nail. And that's actually not the case. That weakens the sides of the Onyfix and reduces its effectiveness substantially. No matter the shape of the nail, it's important to go in a straight line. Now, sometimes, you won't be able to get that far because of the involution, and that's okay. You let that strip do its work, and that means on the next strip you'll be able to get a little bit further and a little bit further. Sometimes it's just a work in progress. Make sure that the Onyfix, you do use a ceramic burr to smooth it out. It's really adhered to that nail, and if you leave a sharp piece and it catches on someone's sock or the sheets, I mean, it could really do some damage because it's adhered very, very well. And again, as you saw in the video, 2 millimeters wide by 2 millimeters high, you can use your cotton swab body for reference. You can also use your Onylux spatula. The very tip is conveniently 2 millimeters wide, so you can compare. I strongly recommend always comparing before you harden because you want to make sure that it's the right size. Again, as we talked about, it's important that the strip is close to the cuticle but not touching it. As long as you can even have a millimeter of space to that sulci, as long as I can just barely fit my very thin spatula in, I'm quite happy. So you want to go as far as you can. You can also taper the edges just ever so slightly. If you can see right here, sometimes people leave this very, very thick so that it's bulging, and then when patients start to walk or put their shoes on, it can press against. You want to make sure that just taper it the tiniest little bit in the corner so that it's not causing them discomfort. Something that's important that we've noticed is that gray zones occur when the nail plate isn't completely roughened all the way. When we're debriding the nail, usually we tend to stick to the middle. We don't get too close to the sides because we're afraid to touch the skin. You really need to debride. You see these circles here? You really need to debride and get right in there because that's where the Onyfix, the ends of the Onyfix strip are going to be, and that's where the bulk of the strength of the strip comes from. So if that's the area that you haven't either prepared or primed properly, it's not going to hold as well. So make sure that you do debride very well without, obviously don't want to cause any tissue damage, but as close as you can, be cognizant of that. Burrs, we have discussed these. You do want to use a diamond burr when you're prepping the nail because you don't want to take so much of the nail off that it becomes a thin nail with more movement. That would defeat the purpose. We want a nice, thick, strong nail to put the Onyfix on if possible. So a diamond burr really is best. It's non-aggressive. That being said, for infection control purposes, we do want to make sure that you use the ceramic burr to refine the hardened composites afterwards. It is important that you turn the water function off. You don't want to use a water drill for roughing up the nail bed. We want that nice and dry and primed. Remember, the primer works by dehydrating the nail. That's what we need. So you can use disposable nail files if you don't have an electric, but you want to make sure they're medium or coarse. They're just a little more work than the electric files would be. A common mistake that some people make is they put too much primer on. They think if a little is good, more must be better. And that's not the case, because if you put more than a single drop of primer on that nail, it actually can leave the nail moist. And we are finding that, you know, doing the minimum of 45 to 60 seconds of curing that primer actually even works better. We want that nail dry. So don't use too much primer, just one drop in the lid, as you saw in the video. Should you have trouble with early fall offs, we've talked about this. If you've got your Onyfix hard on and it keeps coming off, chances are there's either too much movement in the nail or the nail is just too thin and that hard Onyfix isn't bonding properly. Try using a double layer of the soft, as you saw in the video. That's a great tip and trick that's worked for me many times. Something else too that some clinicians are finding, if you have a really, really difficult nail, you can increase the width, not the height of that strip for better results. So if it's just a nail with so much lysis that it's not adhering, try putting a strip that is 2 millimeters high, but now 2.5 to 3 millimeters wide. That's just, you know, when you've tried everything else, this actually is quite helpful in those situations. That's a great little tip to remember. It is important to use rubbing alcohol, minimum 70%. All other products have additives that can affect the bond. Another really important thing to remember is only use non-linting, non-woven gauze sponges. If you try and use, you know, cotton balls or tissue papers, or I don't know why anybody would do that, but it ends up leaving lint or debris behind that can affect the bond. Alcohol swabs are also acceptable. It is a really good idea to get in the habit of wiping off excess residue after each step. So after you apply the primer and you harden the primer, you cure the primer, wipe it off with rubbing alcohol. Then you can apply that just takes away any debris that might still be remaining. Then when you put your composite on and you harden it, again, wipe away any extra debris. It's just a good step to take to just make sure that there's nothing there that might cause that bond to break. Curing time, again, just as a review, for the composites, both 60 seconds and your primer a minimum of 45 seconds. Sometimes I even like to do it just a little bit longer to make sure it's good and dry. So some troubleshooting tips about your battery. We'll discuss this a little bit more during the common question and answer period, but if the composite just doesn't seem to be curing properly, it's really important to make sure that your composite isn't too thick, but also to check your battery. Insufficient curing after 60 seconds means your battery probably isn't properly charged. So you need to plug it in. And these batteries are great. They come with a USB cord. You can actually use the battery or use the light while it's plugged in or using the LED battery. But it's important. We'll talk about the battery just a little bit more in a second, but those are some really good troubleshooting tips if you have a trouble patient. There we go, battery. So it's important to remember to always charge your battery when you initially get the set. Most people, when they put their battery together, it will start without even charging it, and people think, oh, that's great. That's not the case at all. Your battery needs to be at a certain level of charge in order for the light to be strong enough to cure the composite. Don't wait until your battery is fully discharged. These type of batteries really like to only losing a partial charge and then recharging. I know with a lot of our batteries, we like to completely drain them and then recharge them. That is not the way to care for these batteries. A good rule of thumb is to recharge your battery for 3 hours after every 10 clients or so. So excessive charging can actually damage the battery and shorten the lifespan. So a rule of thumb that I use to not overcharge but not undercharge is every 10 patients, when I come into the office in the morning, I'll plug it in, when I get in at 9, and I'll unplug it at noon. It's a good rule of thumb. That way you always know that you've got a sufficient charge, but you're not overcharging your battery, and you certainly don't want to leave your battery charging overnight. It is ideal if you're going away, if you're going on vacation, you're going to be away from your practice for a little while, to remove the battery from the light itself and place it in a Tupperware bin with no other metal or batteries. Just store it in a cool, dry place. It's the best way to preserve your battery. Now, these batteries last for about 300 hours, so they're great batteries as long as you care for them properly. 300 hours is quite a sufficient time, considering you're only spending, a minute or two per patient with it. So as far as the longevity of the composites, the number one cause of it breaking down too soon is sunlight. You want to make sure that it's not in direct sunlight. In fact, it's better to keep it in a cooler place than a warmer place. The number two cause of polymerization is exposure to air. You want to get your caps back on as soon as possible. I mean, they're composite. The composites can dry out if you leave the caps off. The primer is also a liquid, and so it can evaporate. It's really important to set your patient's expectations so that they know what to expect when dealing with the Onyfix. So typically I tell my patients, when I apply a strip of Onyfix, I expect it's going to last a minimum of 3 months. I guarantee my Onyfix strips for at least 3 months because it will fall off. Let them know. Once it gets to the distal third portion of the nail, there's a lot more movement, and it's very expected that the Onyfix will dislodge at that point, and we'll get another strip put on if you don't already have another strip put on proximally. So yeah, I would just make sure to tell your patient that if it were to fall off before the 3 month, before it reaches, no nail is going to reach the distal third portion in 3 months. Just let them know that come on in and we'll replace it free of charge. It really doesn't take much of your time, and it's very cost effective for you. It lets that patient feel reassured. And two, when that strip does fall off, it lets them know that that is a normal and expected expectation. So keep in mind too, those thin brittle nails will fall off sooner, and let them know that as well. Let them know, if this does fall off before the 3 months, and let's say you try it again with the hard composite, you can say, okay, that's fine. We're going to give it a try with the soft. And this is why sometimes it doesn't bond as well to really thin nails, or there's a lot of movement. I find just being very frank and upfront with your patients, I've never actually had an issue with my patients having an issue with it falling off. They don't fall off very often, far less than 5% of the time, but it's still good to prepare them if that's the case. So I just wanted to talk to you, there was a multi-center clinical observation study conducted in Germany and published in the German Journal of Cosmetic Medicine. And this was done, it was funded by the Neuberg Group, as they wanted to observe the results of the treatment in an objective environment. So just a few quick findings that they had. The first was the efficiency for the practitioner. This just goes to show how quickly the practitioner can learn to use it. And really, at the end of the day, within even a couple of applications, most practitioners were applying a strip in less than 6 minutes. For myself, it's probably around the 4 to 5 minute mark per strip. I find it so convenient because if a patient comes in with an ingrown toenail, while I'm removing the ingrown toenail, I can talk to them about Onyfix. I show them pictures of before and afters, and they really, yeah, I'd love to try that. I don't have to send them away and have them come back. I can simply, add it to my treatment. It's 5 minutes. It's not going to put me behind in my day. So I find that very, very convenient. And then your patient can start benefiting right away from the Onyfix application. This is looking at the effectiveness of nail deformations. So it's a reverse chart that shows the most severe curvature at the beginning, and by week 6, already a significant decline, with the optimal effectiveness noted at week 36. Nail bed changes. This is looking at the subsequent aggravation of the nail bed from that curved nail. That curved nail is constantly aggravating the nail bed, causing hyperkeratosis in the sulci, causing all sorts of irritations to the nail bed. And we see a steady decline up until week 36. This is something I notice very, very acutely in my patients, is that the nail bed gets so healthy so much quicker. Subjects with pain. This is a big one. At the start of the study, we noticed there was about a 60% report of nail pain, and by week 6, this was down to reported 1%. I have to tell you that my Onyfix results, even if Onyfix didn't correct the involution or those problems, which it does, I would use this product simply for its effectiveness with pain. So it's very effective for pain when you put that distal half strip on when a patient has an acute issue. But in addition to that, when you put a proximal strip on, they're not going to feel a difference right away. But what they will notice that over a period of a month, typically, they'll come back and say, wow, I haven't noticed any pinching or pressure. I almost forgot my appointment with you. And these are patients that have seen me long term on a monthly basis because the nail is so involuted, and they're feeling that pinching and pressure, and they've chosen for whatever reason to not have the surgery done. And so not only are they feeling, and the longer the Onyfix is on, the less pinching and pressure that they feel. In addition to that, I find at the 2-month mark, when a patient comes back after having Onyfix on, I get excited. I get a little bit of butterflies because I know I'm going to actually see a difference. And when I get my curette and my X file in there to check in the sulci, I can feel a difference. I can see how the Onyfix has now created more space and is causing less pain. And so when these patients come in for their treatments are less uncomfortable. It's really such a fantastic product. And, you know, I have to let you know, I see a lot of patients monthly because of extreme involution, and they choose not to have matrixectomy. And a lot of them, if they went without that treatment, they end up getting ingrown toenails and subsequent infections. And during COVID, we weren't allowed to practice for a 3-month period. We didn't practice unless there was an emergency situation. And not a single patient of these very acute patients that I had applied Onyfix to got an ingrown toenail or even complained about pain when they got back. And they're so cute. They use the same verbiage. They don't remember the name of the Onyfix strip, but they just remember, hey, you know, it's a sure good thing that you put that strip on me. I think it got me through COVID. And across the board, they all use the same verbiage. So your patients are so happy with the results, even just regarding pain, that it is so worthwhile in your practice to have this. To me, this product should be in absolutely every single practice as another therapy that we can provide. The next topic there was just the overall effectiveness that the participants had with the Onyfix system, and by 24 weeks, there was 100% satisfaction. So that's really interesting to note. I always say that a picture is worth 1,000 words, and I strongly recommend that we can, when you do purchase the kit, you can have access to all these pictures. I put several pictures on glossy, high-resolution paper because sometimes when you're explaining Onyfix to your patients, they seem to get it, but they don't quite. And when you show them these pictures, it's like a light bulb moment, and they say, oh, I get it. So look at this picture. This is an ongoing case right now that we're working with, but look at how folded over that nail is, and over a period of time. Now this nail's still probably going to need a couple of strips, but look at, who would have ever thought that something that is absolutely pain-free and completely safe could take a nail like that and correct it. It's just absolutely phenomenal. This is an example of that double strip that I was talking about. If you've got a really strong pincer nail, like you see, sometimes having a full second layer strip distally will help speed things along a little bit quicker. So we're going to get into some frequently asked questions. The answers to all of these two will be made available to you. I just find it's easy for me to address them. I'm sure a lot of you have burning questions right now. So let's address some of them. What is the downtime for my patients after having the Onyfix applied? Zero downtime. I always make a joke. I say, well, you know, if your patient wants to go in the hot tub, if they want to, you know, go for a run, I don't know why anyone would want to run, but some people like to do that. They can do anything that they had planned to do as soon as that Onyfix compound has been cured. whatever it is. There's no downtime. They can get it wet, they can have pressure on it. I'll skip down. The next question women usually ask is, can I wear nail polish over top of the Onyfix strip? And the answer is yes, you can use nail polish as long as it can be removed. It's regular polishing can be removed with acetone. You don't want to be putting gel or shellac over top of it, because if it has to be debrided, you might debride the Onyfix strip off with it. So yes, you can wear nail polish, but it's got to be regular nail polish. Are there any contraindications to using Onyfix? No, we have not come across any contraindications because it doesn't touch the skin, so there's no allergies reported, and it doesn't provide any sort of torque. It simply provides support for the nail as it naturally wanted to grow. So I have used Onyfix on a 99-year-old diabetic person with a previous amputation and someone as young as 3 months of age. Yes, it can be used during pregnancy. Can I get the Onyfix wet? Yes, I did address that. Can I use the Onyfix on an infected toe? Great question. Thank you for asking. You have to keep in mind that body fluids, remember I said the skin has oil? Well, the skin and any sort of body fluids can cause a disruption in the bonding process. So that is going to be a clinician's judgment call. If you're just dealing with a teeny tiny spicule and the area is irritated, but there's no drainage, yes, you could put an Onyfix strip on. But if you've got like a massive infection where it's weepy and oozing, absolutely, I would not put the Onyfix on at that time. I would have them come back after being on antibiotics. It needs to dry out. The Onyfix needs a dry environment to thrive. Can I use the Onyfix on a thick or graphotic or fungal nail? Can I use it on a pincer nail? The answer, of course, is yes, yes, yes. I think I mentioned earlier, the thicker the nail is, the better the Onyfix. It loves it. It's just the more stable the base, the more stable the Onyfix is, and it will just stick on there like glue. Absolutely, you can use it for pincer nails. Pincer nails are going to take a little bit longer to be corrected, obviously. And as I said, I do find with pincer nails having a double strip sometimes can speed the process along. What is the best timeline to have patients come back for a follow-up? That is a very common question. So if this isn't a regular patient for you, what I would recommend doing is having the patient come back, apply the Onyfix, have them come back at 6 weeks. And the reason that I say that, if it's a severe involution and you've only put a proximal strip on, chances are the distal area is quite tight and it's gaining in debris and whatnot and is getting tighter again. So have your patient come back at 6 weeks and clear it out with your curette, see how things are doing, lax file down the distal portion, and then have them see you again 6 weeks after that. And the reason they come and see you 6 weeks after that is because that puts them at the 3-month mark. And by the 3-month mark, that proximal strip is now quite distal on most healthy nails. You know, it's probably at least halfway up the nail. At that point, I will put on an additional distal strip. So you'll have 2 strips, and I would leave the first strip on until it falls off. Your patient can only benefit from having those 2 strips on. Just say we're going to put on this strip so that when the first one falls off, it's getting into that danger zone. When it falls off, you'll already have another one on carrying through. Then have them come back every 3 months for another application, a proximal strip. And as they continue to grow, you just keep applying it every 3 months. And I find that works really well. Obviously, that's patient dependent. Some patients' nails grow very, very slowly. I mean, I've had some patients where it stayed on for 8 months. You certainly don't have them come back at 3 months. So use your discretion based on how quickly your patient's nail is growing. What is the expiration date of the product? We do get asked that a lot. Because it's a kit, we do have to put the expiration date of the first thing in the kit to expire, and that's going to be the primer. And that's going to be about a year, typically, depending on the lot that comes from Germany for you. And the only reason for that, it's not that it loses integrity, it's just that it's a liquid and can evaporate. So that's why you'll notice most of them have the expiration date of a year. You'll be going through your Onyfix like crazy, so it probably won't even be an issue. How long will each band of Onyfix stay on for? Again, patient dependent on how quickly. A 25-year-old strip is going to probably grow out a lot quicker than a 95-year-old graphotic nail. Typically, I'm finding in my patients, my practice ages 25 to say 65, it's staying on for about 4 months. Anything before the 4-month mark, I think that maybe something was, before the 3-month mark, I replace free of charge. Anything after 3 months, but I typically tell my patients to expect it to be on about 4 months. How many bands of Onyfix will it take to correct the involution? Again, very patient dependent on how quickly the nail grows, but also the degree of involution that your patient is experiencing. I'm typically finding in my practice 2 to 4 strips of Onyfix is typically enough. Most of the patients that I've had pretty severe involution and have required the Onyfix to be on for just over a year. So if it's a severe involution, I tell my patients you're probably going to need the Onyfix strip on for likely just over a year. And so how many strips depends on how quickly their nail grows. Once I've corrected the issue, I did address this already. Once I've corrected the issue or the involution, will it reoccur? We are not finding that it's reoccurring at all. I have not seen it in my practice. Again, if your patient is using poor behaviors like wearing very unfit footwear, you know, they have to be smart and take care of their feet. But no, we're not finding that it involutes. Oops, I think I just skipped ahead. Excuse me. I did. If I have a clinical question, what should I do and who should I contact? You are going to get the commonly asked questions list. Why do the strips sometimes dislodge? I know that we did discuss this already. I'm going to go through them really quickly because this is probably the biggest issue that we get questions about. So again, make sure it says cure the primer for 30 to 45 seconds. I really prefer a minimum of 45 seconds. I really find my results are better, and making sure you're wiping away any excess moisture following the curing process. Make sure the battery in your light is fully charged. There isn't an indicator light to show when it's charged, so plug it in for 3 full hours for that maximum charge, and then recharge for 3 hours every 10 to 15 patients. The Onyfix may dislodge if the nail is very thin or if there's some onycholysis present. And if this is the case, you might want to try applying the 2 layers of soft as you saw in the video. Always make sure the strip is 2 millimeters high by 2 millimeters wide for your best results. But do remember, if you have one of those very, very troublesome nails, you can put a double layer of the soft so that it's 2 millimeters high by 3 millimeters wide. Make sure you don't touch the skin during the bonding process. Don't use a water spray. Make sure you use non-woven sponges so you're not leaving lint behind, and make sure that Onyfix strip goes straight across. Don't be tempted to get into that U shape because that can cause it to dislodge early. So we get asked, how do we implement this in our practice now? Typically, the average price per treatment, most practitioners are charging about $90 per strip per toe, in addition to your session, so your foot care fee, whatever that might be, and then this would be in addition to that. Most practitioners will provide a free replacement if it falls off under 3 months, because that does indicate maybe there was a practitioner error. Really, it ends up working out. Your professional cost works out to about $8 per strip, so it doesn't really hurt you to offer that guarantee. And as we discussed, it takes 4 to 5 minutes of your time just to give your patients and that good sense of business. Again, we've talked about how many strips they'll need. Again, I just tell my patients you're going to probably need the Onyfix on for about a year if it's a significant involution or pincer nail. However many strips that takes, the average strip lasts about 4 to 5 months in a healthy nail. So why do we use Onyfix? For all the reasons I've been discussing all day. It is truly an all-in-one universal system for multiple nail dystrophies. It goes beyond just the ingrown involuted nails. We have restoration and reconstruction too. It is absolutely revolutionary. It's only been in Canada now for about 2 years, so get on board because it is absolutely blowing up. Keep in mind, there's so many patients that you can use this for, those patients that can't or won't have surgery, children, special needs patients. So the return, if you think that you're getting, think of it, 70 to 80 treatments per starter kit, really your return on investment, depending on whether you're charging, $90. I've seen some practitioners in downtown Toronto charging $225 per strip. You have to do what's right for you, but really your return on investment is between $6,000 and $16,000. It is definitely worth your time, but more importantly, you're giving your patients another option. You're providing them with something that is better and safer. You should be using this product. So to become certified, you watch this video. This video had both the theoretical and clinical video attached. So once you watch this, you're good to go. We're also going to attach the clinical video just for your ease of reference, just so you don't have to watch this whole video again if you have clinical questions. You purchase your Onyfix starter kit and certification fee. I want everybody to stay tuned. You will be getting hopefully another link from me about the Poto Expert line. Now, when I went to Germany a couple years ago to learn about the Onyfix, they showed us this absolutely revolutionary skincare line. I have to be honest, at first I wasn't terribly interested in another lotion until I actually saw the results. This is something that can repair the skin. Everything, and in just 30 days. Everything right now on the market simply moisturizes the skin, and moisturizing means it treats the symptoms. It doesn't actually address the cause. This actually addresses the cause, the root of the problem. So please stay tuned for that, because if there's one other product other than Onyfix that has absolutely changed my practice and benefited my patients, it's the Poto Expert line. Thank you so much, everybody, for listening. I hope to hear from you soon.